Greetings. Let us talk about infections that can occur in the endoscopy unit. It could be involving the patients or the endoscopy staff. Let us talk about infections transmitted to the patients first. And let us look at nosocomial infections. These are infections that are transmitted in the hospital, and a couple of definitions that we need to understand. What is a pathogenic organism and what is a non-pathogenic organism? Pathogenic organisms result in disease, while non-pathogenic organisms do not cause any disease. Now let us look at examples of pathogenic organisms: flu and various waterborne viral and bacterial illnesses. And typical examples of non-pathogenic organisms include gut flora. So let us review about bacteria, viruses, and prions with special reference to the endoscopy unit. So in terms of the bacteria, Clostridium difficile and vancomycin resistant enterococcus, otherwise called as VRE. So these infections are typically transmitted by contact, and healthcare workers could be responsible for transmitting the infection if they do not practice proper hand hygiene techniques. So how do we prevent these infections from happening? That is C. diff or VRE infections. It boils down to taking 20 seconds to wash your hands properly with soap and water as shown here. And a thorough hand washing is really critical, especially for spore forming organisms like C. difficile. Using a hand sanitizer will not work for C. diff. Let's talk about a little more about other bacteria that are relevant for infections in the endoscopy suite. CRE. We have heard a lot about this carbapenem resistant Enterobacteriaceae species causing severe infections. People have died from these infections, and when we looked at it, they were traced to ERCP and EUS scope that has an elevator, and the elevator makes it very hard to clean, and that problem has resulted in infections. The FDA has asked all the major companies, in fact all the companies that manufacture endoscopes, to come up with a fix to this problem. And some have come up with a disposable tip, and others have come up with a disposable endoscope to manage or avoid this infection. Let's talk about other bacteria that are important. Multi-drug resistant Pseudomonas aeruginosa. And this typically happens if we fail to reprocess the endoscope properly, or we use water bottles that are not sterilized, or keeping the water in the water bottles and reusing it day after day, and the Pseudomonas grows in those water bottles. How do we prevent this infection? It boils down to doing every step of the pre-cleaning and manual cleaning, high-level disinfection, drying, and proper storage. Every step is important, and doing it properly avoids this type of infection. Other infections of bacterial nature that should be considered are Helicobacter pylori, which is a bug in the stomach, and this can happen with failure of reprocessing the endoscopes properly, and it also happens with the reuse of a biopsy forceps if the forceps has not been disinfected properly. So let us move on to the viruses. Hepatitis C, HIV, and hepatitis B, all should be vaccinated irrespective of their profession when they were born for hepatitis B. That has led to less of a problem with hepatitis B. Hepatitis C became a big issue with the use of multi-vial propofol, and there was a big outbreak in Las Vegas. HIV gets cleared with the regular processing, and scope related transmission of HIV has not been reported. So hepatitis C could happen with a needle stick injury, and if we fail to reprocess the scope properly, and with the use of multi-use vials. What do you mean by multi-use vials? So in this center in Nevada, Las Vegas, Nevada, the endoscopy team used multi-use propofol. So they use the same syringe to draw propofol and then give to multiple patients, and that has become a big problem. So let us talk about infection control and safety practices. And let's look at this picture and see how we can avoid this by taking proper precautions of disposing the shops, avoiding multi-use vials for sedation, and proper disinfection of endoscopes. So all these measures are really critical. So let us look at other viruses that could get transmitted by air and as well as contact. We are in the midst of COVID-19 pandemic, and it's important to understand that COVID-19 can get transmitted by droplets, airborne transmission, as well as contact transmission. So it is important to wear proper PPE for droplets as well as for high risk procedures. Airborne precautions should be taken. Lastly, let's talk about prions. These are misfolded proteinaceous infectious particles, and these prions are resistant to disinfectants, and these come from infected meat, and they could result in a variant of Creutzfeldt-Jakob disease. It is a very serious neurological disease caused by the consumption of beef contaminated with prions, and this is fatal. So if you need to do, if you see somebody who has a variant of Creutzfeldt-Jakob disease, you should avoid endoscopy in those patients as far as possible. But if you need to use a scope that is dedicated to patients with this disease, or one that has been retired after use, and do not mix that endoscope with the rest of the endoscopes. So keep that scope as a dedicated scope for this type of infection in patients with this type of infection. Fortunately, this problem is rare, so we don't have to worry too much about it. Say, for example, you realize that the patient that you have taken care was exposed to infection, and what should you do next? You should inform the hospital infection control team, and the hospital infection control team will certainly reach out to the local public health agency. And it's also important to inform FDA MedWatch as well as the manufacturer of the equipment. And finally, it is critical to inform the patient and have a plan to manage the patient and follow up the patient until they are free from any serious threat to their health. So it is a big deal if a potential infection happens in patients because of not following proper protocols of endoscope reprocessing. So we have to take every step seriously in reprocessing endoscopes. We also have to take every step of maintaining proper hand hygiene as well as proper PPE wearing and doffing. So let's go to infections transmitted to staff. Healthcare workers are at high risk for infections. In this COVID pandemic, a lot of healthcare workers succumb to this illness. So being in healthcare poses some risks. And let us look at those risks to the endoscopy staff, and let us look at some examples as well. So droplet/airborne infections include flu and COVID-19. So if you think you have flu or if you think you have COVID-19, the best thing you could do to prevent infection to your colleagues and to patients that you serve is to stay at home and reach out to your physician for further advice. So if you think you have flu, stay at home. The next is contact. Examples include MRSA, that is methicillin resistant Staph aureus, and C. difficile. And the best way to prevent this is proper hand hygiene and using contact precautions, wearing a gown and wearing gloves. And the third one is sharps. You have to take every precaution to dispose of the sharps properly. Otherwise, a sharp injury or a needle stick injury could put you at risk for HCV, that is hepatitis C, HIV, and hepatitis B as well if you are not immune to hepatitis B infection. Let's take a step further and talk about droplet/airborne transmission. So here is a case, and as you can see here, we are doing endoscopy. All the team members are close by, monitoring the patient very closely. And if in case this patient has COVID-19, you have to change your practice. You should bring the patient with a mask until you're ready to sedate the patient and put the scope in. and you maintain the social distance of at least 6 feet or more, and have proper PPE. And unlike a regular procedure, when you're performing endoscopy in somebody with COVID-19, you should minimize the number of people working in the endoscopy room. And it is critical to avoid infection. And it's also important to minimize aerosol spread. So you want to avoid nasal cannula. Instead, you use a special mask. In some high-risk cases, you may even end up putting an endotracheal tube. Once the patient recovers, the patient should be put on a face mask to prevent a droplet transmission. In addition to taking all the precautions for droplet and airborne transmission, in patients who are at risk for airborne transmission, you should do the procedure in a negative pressure room if that is available. In COVID-19, it is also important to deal with contact transmission. One should take precautions using special wipes that are virucidal wipes, and clean all metal and surfaces as well as working surfaces to prevent contact transmission. After the procedure, we should take special precautions while doffing the PPE so as to not contaminate in the doffing procedure. It is a good idea to have an observer help you through the doffing procedure. As part of this thing, it is important to train people in proper PPE donning and as well as proper PPE doffing. So both donning and doffing are critical. Finally, hand hygiene is really critical to keep yourself safe. In high-risk patients, especially those who have had spore-forming infections like C. diff, you should wash your hands using the protocol for at least 20 seconds and dry your hands. In other cases, when the hands are not contaminated or otherwise clean, hand rub with a sanitizer will work. How about dealing with the sharps? Forceps do have a spike, so the assistant should take precautions in closing the forceps before handing it over to the endoscopist. And finally, after you use a needle or a knife, you want to follow standard precautions, proper infection prevention, and general hygiene practices in disposing of the sharps. How about managing an exposure? If in case you had an exposure, what should be done next? You should inform your manager and employee health immediately. They will have a protocol to take care of you. If in case you do not have one, you should consult an expert, and if it is related to HIV or HCV exposure, they may consider, depending upon the risks, begin preventive treatment, and if that started, you need to comply with the treatment. And also, you should closely monitor for adverse events. Thank you.